As this research will show, there are a lot of risks involved with this class of medications. My medical disclaimer, I'll let you read that on your own. So how do proton pump inhibitors work? They reduce stomach acid production through long-acting blockade of the stomach's hydrogen-potassium proton pumps. Blockade of these pumps can relieve symptoms of GERD, heartburn, indigestion. So that might seem great, all well and good. Here's the problem. Well, let's first get into the history. The first proton pump inhibitor developed was something called omeprazole. There are other PPIs out there on the market. For your reference, here they are: lansoprazole, dexlansoprazole, pantoprazole, and esomeprazole. PPIs are sold over the counter and commonly thought to exhibit few side effects. However, proton pump inhibitors are not without side effects, and it seems like my time here in the last 20 years of being a pharmacist is there is unfortunately more research coming out with the hazards of these side effects. Proton pump inhibitor side effects. Please understand the magnitude that some of these side effects can have. I don't want to unintentionally extrapolate some of these side effects into other issues, but I will give you my opinion on what I think potentially could be happening downstream, especially being on these types of medications for longer than what was intended. Risk of mineral deficiencies. So calcium, magnesium, iron, zinc. Essentially what is going on, there's a few mechanisms here, but proton pump inhibitors, as I already mentioned, reduce the stomach acid in our stomach. It actually blocks the production of stomach acid. So the problem here is we need that stomach acid to dissolve certain minerals to get absorbed into our body. So we're inhibiting, again, the absorption of these key nutrients, or the risk is there. Risk of vitamin deficiency. So we need stomach acid, we need hydrochloric acid in the form of stomach acid, HCl, to absorb B12, vitamin C, and even vitamin D. So if you are on a proton pump inhibitor, I strongly encourage you to work with your provider, work with your doctor on assessing these minerals and vitamins and see if you're deficient. And if you are, obviously treat appropriately. Different anemia, so that's going to go back to your iron and your B12 and other issues in that regard. You're not producing enough red blood cells. This should come at no surprise. Unfortunately, we can see more bone fractures in patients that have been on long-term proton pump inhibitors. The reason for that is, as you could probably figure this out, we're not absorbing enough calcium and we're not absorbing enough vitamin D, and those are two building blocks for obviously strong bones. Liver and kidney disease. So if you are someone, again, long-term on proton pump inhibitors, please take a look with your provider on assessing the function of your kidneys and liver. This may not come as obvious, but if you think about it this way, the stomach acid, it's obviously produced to digest our food, absorb our vitamins and minerals, as I just talked about. We need stomach acid to also help to basically clean our food, right? We know that food isn't sterile, and so there's different bacteria and viruses in the food that we eat, and parasites and so on and so forth. And we see an increased risk of C. diff infections. Now there's a couple of issues there that, in my opinion, are going on, is that when we reduce stomach acid, we're disrupting essentially everything downstream from the stomach, so your small intestines, your large intestines, and that we're disrupting the pH balance cascade. And so now we get opportunistic infections because you have different bacteria that thrive better in an alkaline or a high pH, and now you're taking a medication that is raising the pH. And again, if you're having heartburn, you're producing too much stomach acid, that can lead into a problem with infections. You get the disruption of lowering the amount of good bacteria in your GI tract and basically unnecessarily upregulating the environment to grow bad bacteria. And you can see community-acquired pneumonia is on this list as well. So again, we need to really pay attention to how long we are on these medications and really assess the need for these long-term especially. Dementia, that's scary. Proton pump inhibitors, you can be, again, treating your acid reflux, your heartburn, so on, and now you're on this medication for 5, 10. I've seen patients come into our pharmacy that have been on proton pump inhibitors for 15 years, even more. And I hate to wonder how many of those patients really know that dementia and basically memory loss can be caused by their acid reflux medication. So certainly if you're at risk for dementia, memory loss, obviously I would strongly encourage you to work with your provider on seeing if there's an alternative to your proton pump inhibitor to help treat your symptoms. And something that just came out, this is one of the reasons I was doing this video, is that I will show this on the screen, but cancer, your risk of stomach cancer doubles. There was a 2-fold increase of gastric cancer in a systematic review with meta-analysis. This was published back in 2021. So if you are on a long-term, I would say anything over 3 months in my opinion, but especially anything over a year, work with your provider, the doctor that is prescribing this medication to you, and again, I would assess if you really need to be on this or if there is a safer alternative for you.